Let's talk about the NCLEX test plan. Right. Let me explain using this. So this is you. This is your friend. Right. You are from Miami. Your friend is from Naples. Right. So you want to see your friend. Right. You want to see your friend. Now the problem is that you don't know how to get to where your friend stays. So now you need your friend location, a clear direction, and then how you can easily access the direction what using Google Map. So finally, you got to see your friend. Now, the initial problem is that you want to see your friend, you don't know how to get there. So you utilize all this in order to what? Finally get to what? See your friend. That is how the NCLEX exam work. Now let me clean up. Now, you want to take the NCLEX exam. Your question is like this. Right. You want to take the NCLEX exam. So you have a question like this. Now, you want to take this NCLEX exam. Same way you want to what? See your friend. Now, the problem is that a lot of students always used to complain that they don't know what the question is what asking. Same way you don't know how to get to the location where your friend is staying. So now, in order to understand what the NCLEX is asking, you need to know the content. That's what you need to know. Now, in order to get to see your friend, you need the location, a clear direction, and what? Your Google Map. Right. So in order to know what the NCLEX is asking, right, you need the content, right, and you need to know about the NCLEX question structure in order to know what the NCLEX is asking. Now, let me ask you two questions. Now, one, I will ask you one question. Now, if you when you are in nursing school, right? When you are in nursing school, right? Did you take an exam before teaching? Obviously, the answer is no, because you will get initial teaching before you take what? Any exam in nursing school. Right. That is how it works. Now, a lot of students will say, uh, because now this is the problem. When a lot of students are they are done with nursing school. Now you are done with nursing school, right? You are done with nursing school. Now, instead of most students to start thinking about what the NCLEX is all about, the next thing they think about is the question bank they need in order to what? Pass the exam. Now, a lot of students will say, why is it that I should not get a question bank? Now, let me explain question bank routine and let me explain NCLEX routine for you. Now, question bank, you get question bank. What will question bank do for you? They will give you what? 2,000 questions. Now, you are going to answer the question. You can get it some correctly or you're going to get some what? Wrongly. Now, if you get it correctly, you move. If you get it wrongly, what? You start checking what? Rationales. Right. Now, the only prior knowledge you are using to answer this question is your nursing school knowledge, right? That is what you're using to answer this question. Now, guess what? The NCLEX is not interested in so much of your nursing school knowledge. Instead, they are interested in specific knowledge, right? Knowledge that make you ready to practice and also show that you are a safe nurse. So now, if you don't have access to this knowledge, the specific knowledge NCLEX want to test, then when you go on the NCLEX exam, you are gambling the exam. Now, guess what? While you are practicing on any question bank, you don't know those specific knowledge. You are only relying on your nursing school knowledge. That is one. And two, the ability for that question bank program to tell you you are ready to take the exam. That way you feel like, oh, yes, I'm ready to take the NCLEX exam. Now I can pass. Now, let me tell you the truth. You can pass even without using question bank, right? I always used to tell my students, if you end up passing the NCLEX exam with question bank, it only shows that you could have passed without the question bank, because question bank don't test you the way the NCLEX should test you. Instead, they just make you feel ready. You have the knowledge already. You just need a question bank to make you what? Feel ready. Right. Now, guess what? That same question bank that you are using, some students are using it to pass, and some other students are failing with that same question bank. Now, guess what? What you learn in the question bank is the same thing other students as well too are learning. Right. So, if this student failed the NCLEX exam, what's this particular student thinking? To get another question bank. Now, I always used to ask myself this question. I'm like, this question bank right here made 80% of students to pass. Now, guess what? If you happen to be 20% of who failed using this question bank, now you are now getting a new question bank. Why? My question is why? Now, you are getting a new question bank, maybe because you feel like this question bank is not good for you, and that is the reason why you end up failing the NCLEX exam. But what happened to 80% of students who use that same question bank and end up passing the NCLEX exam? Right. If you are getting my point, what I'm trying to drive at is that the reason why a lot of students fail the NCLEX exam is not because of the question bank. You are not the problem as well too, but your approach is the problem. The moment we can fix this approach, then you will get to understand the NCLEX exam and you will get to what? Pass the NCLEX exam. So let us fix that approach. Right. So that's the reason why I want to tell you about the NCLEX test plan. Now, I'm going to give you two scenarios. If you don't use the NCLEX test plan, guess what? You are gambling your exam. It's just like using medication without not knowing what to use. Guess what? You are putting yourself at risk. So why are you going to take the NCLEX exam when you don't know what is going to be on the exam? Now, I've seen this a lot of the time, right? Whereby a lot of students will be asking which question bank program is similar to the question on the exam. A lot of students will ask, how many questions on this specific program did you saw on the NCLEX exam? A lot of students ask that. Right. It only shows the reason why a lot of students are using question bank and why a lot of students end up what? Failing, despite some people end up what? Passing. Now, the missing problem right now is you don't understand the NCLEX. You are going on the NCLEX exam with no prior knowledge, only relying on what? Question bank. That way, you are gambling the exam. So your first approach to the NCLEX exam is understanding the NCLEX. Now, On the NCLEX exam, let us think right now. Let us say today's your exam. You are taking the NCLEX. Now you saw your first question, right? The first thing most students are thinking is what the question is asking, right? And next thing they are thinking is what is the answer? But this comes first. What is the question asking and what is the answer? Right. So now, to know what the question is asking, that is the reason why NCLEX have every NCLEX question have three parts. Every NCLEX question have three parts. Now, we have the body, we have the stem, and then we have what? The answer keys. We have the body, the stem, and then answer keys. Now, pay attention. Now, on the NCLEX exam, we have a lot of what? Let me say different question style, right? We have different question style. We have standalone, select order, apply, case study, bow tie, chart, drag and drop, a lot, right? But the most common question on the NCLEX exam that you're going to see 70% of the time is what? Your stand-alone type question. That's the reason why in my course program, I break the three question part using what? Standalone question. So that's what we are going to be using today. Now, you have your standalone question like this. So you have the first part, you have the second part, and then you have your answer key. Right, which is the third part. So this is the first part, second part, and then third part. There's a reason why NCLEX put together the question like this. Right, there's a reason why. In nursing school, you might just have all your questions like this and then your answer key, no clear understanding on the writing style. But you need to understand the writing style of the NCLEX exam because there's a reason. Now, when you are in nursing school, right, when you are in nursing school, uh, this is your lecturer, this is you and your fellow classmates in class, right? This is the board. Now, your lecturer want to give you an exam on hypertension, right? Now, guess what? This is what you know that the NCLEX, sorry, your examiner want to test you because I'm talking about nursing school right now, right? Talking about nursing school. Now, so this is what you know that your lecturer want to set, right? Your lecturer want to test you on what? Hypertension. Now, guess what? What we don't know is what? The question that will be tested, despite the fact we know hypertension is what we are going to see on the NCLEX exam. Oh my God, why am I saying NCLEX exam? Now, nursing school exam. I've been coaching for 2 years, so I'm used to the NCLEX. Right. Now, the your lecturer and your lecturer said, student, prepare for hypertension. We have a test on hypertension tomorrow. Now, what we know is hypertension is what will be tested, but we don't know the question that will be tested. We don't know how the lecturer is going to write the answer keys. Right. So these two things is what we are missing right now. But guess what? We know this. Now, that is how the NCLEX work. Now, the NCLEX use the NCLEX test plan to inform the student about the content that will be tested. Now, knowing the content on the NCLEX exam don't automatically expose the exam question because NCLEX feel like the moment you are taking your exam today, they believe 100% you are aware of what the content on the NCLEX exam. Now, that is what the NCLEX test plan contain. The NCLEX test plan include what? The content that will be tested on the NCLEX exam. Right. So if at this point you are not using the NCLEX test plan, then there's a big problem. Is either you like to repeat the NCLEX exam multiple times or you just love to fail the NCLEX exam. Right. Because obviously, you need to know what will be tested on the NCLEX exam. Right. In nursing school, you learned a lot of things. But on the NCLEX test plan, the NCLEX have for the RN 146 content that will be tested on the NCLEX exam, and then for PN 150 content that will be tested on the NCLEX-PN exam. Right. So now, before you take your NCLEX exam, you should have covered every of the 146 contents and every of the 150 contents. So now you are ready for the first part of the question. Remember, I said we have 3 parts, right? Now, the first part is what? The body. Now, the body of the question is where you are going to see the content. Now, take for instance, this is the NCLEX writer, and then these are the students taking the NCLEX exam, and one of the content is hypertension. Right. This part, which we call the body of the question, you are going to see hypertension there. Right. It means that the NCLEX is testing you what? About, let's say hypertension is one of the content. This is where you are going to see hypertension. Right. The body of the question. You will never see hypertension on the stem. The body of your question is not the question. The body just include what? The content. The body is not the question. The body is not asking you anything. The body is just making you aware of the content that the NCLEX is testing. Where are you going to get the content again? From the NCLEX test plan. That's where you're going to get the content. Now, the content, you are going to see it. Yeah, the body of the question. Now, the next part is, now we know the lecturer is going to test us on what? Hypertension, but we don't know the question. Now, the STEM, because when do we get to know the question? On the day of the test. That's when we get to know the question. But on the NCLEX exam, right, you figure out the content from the body. Now, the STEM is now the question. You can see where the question is now. The STEM is now the question. Right. So now the question is asking you anything related to the content that you previously figured out from what? The body of the question. That is the reason why NCLEX have 3 parts: the body, the stem, and then the answer keys. Now, this last part right here, you can see 1, 2, 3, 4, that's your answer keys. Now, this is your answer keys right there. You can see. Now, a lot of students just see NCLEX question and they're just going to read through. A nurse is so about so one, we should do so to the patient. 2, we should so 3, we should so. That is how they read the question. But now that you understand the NCLEX, now you know you need to go through the body of the question and figure out what is the content. Now, when you identify the content, now you are now going to what? Read the question that the examiner is asking from the STEM and what the exam is asking related to what? The content. Now, in nursing school, if your lecturer is going to test you on hypertension, we know a lot of questions can come out, right? That will test you on hypertension. Your lecturer can say what is the normal range for what? Blood pressure. Your lecturer might tell you what are complications related to what? Hypertension. That is how the NCLEX as well to work. We know the content, but any question can be tested. But we need to read the STEM to understand the question. Now, the reason why a lot of students will read their question, read the answer key, and go back and read the question again multiple times is because they don't understand what the NCLEX is testing. So I call that what? Confusion. Now, those particular students, they fail to understand how the NCLEX work. Instead, they jump straight to what? Studying or utilizing what? Question bank that is not explaining anything to them. Now, what will question bank just do to you? Give you what? Thousands of questions, and you get to figure it out yourself. Right. So now, the first thing you need to do is to understand what, as I said, the NCLEX. Now, the moment you understand the NCLEX, now let me give you the roadmap. Let me clean up. Let me clean up. Now, the moment you understand the NCLEX, This is how the NCLEX work. Now, the NCLEX, know that what you have right now is your nursing school knowledge. Now, this your nursing school knowledge, NCLEX want to use it, want you to use it to show that you can what? Practice and show that you can be a safe nurse. Now, in order to show that you can practice, NCLEX want you to be familiar with what? The 8 client needs. Now, in order to show that you are a safe nurse, you should be able to answer questions related to what? The 6 concepts. You see how the NCLEX work? Now, 8 client needs. Now, the 8 client need is what is on the NCLEX test plan. Right, the 8 client need. Now, the 8 client need we have for RN and we have for what? PN. The 6 concept is the same for RN and also the same for PN. Right. This 8 client need now for for the RN, this 8 client need gave birth to the 146 content. Why this 8 client need gave birth to the 150 word content for PN. Now, this concept is tested in every of these content. And this same concept is tested in your what? 85 to 150 question on the NCLEX exam. This is what the NCLEX is testing. The 6 concepts. Yes, in nursing school, right? Your nursing school question might be testing you about your nursing school question can be testing you about hypertension, and you are answering the question related to hypertension. But this is how the NCLEX work. Right. You are seeing hypertension on the NCLEX exam, but the NCLEX is testing you on a specific concept related to what? Hypertension. Now, let me list the concept for you so that you understand what I am saying. Now, we have concept of caring, we have nursing process, right? We have clinical judgment, we have culture and spirituality, right? We have teaching and learning. So caring, nursing process, clinical judgment, culture and spirituality, and learning. Then we have communication and documentation, right? So you can see 1, 2, 3, 4, 5, 6. Now, when NCLEX is testing you about caring, NCLEX can give you hypertension, but guess what? When NCLEX is testing you about caring, NCLEX is not asking you to treat the patient. Caring question involve interaction. So what are we doing? Now, if you see caring question on the NCLEX exam, it only involve what? Interaction. There's no treatment involved. You are not giving anybody medication. You are not sending anybody for procedure. You are not looking for sign and symptom. You are not looking for anything. You are just interacting. Example, maybe a patient who has schizophrenia is experiencing what? Hallucination. Now, you are only going to interact with that patient. So now, hallucination, right, can bring up safety concern related to what? The patient in, themselves and who? The staff or other clients, right? Now, but you are only using what? Interaction to fix that safety issue by asking the patient, what is the voice telling you? You can see how powerful it is, right? Because a lot of students think safety is about who is going to die. No, safety is not about who is going to die. Even a patient that is experiencing emotional breakdown can be at risk for safety issues, such as what? Committing suicide. Right. Now, another example that is on the NCLEX exam is a patient who have what? Diabetes, and they are complaining about giving themselves their insulin. Right. They were complaining about giving themselves their insulin. They said it feels difficult, right? Having to give themselves what? Insulin every day. Right. So this is a patient complaint. Guess what? This is diabetes, but the NCLEX is not testing us on any form of treatment related to diabetes. Instead, NCLEX is testing us on the patient what? Concern. So how are we fixing that? Automatically, I know this is a caring question and I'm fixing that with interaction. So I'm looking for a specific answer related to interaction. That is where NCLEX will definitely be putting on your stem, right? You have the body of your question stem. You're going to be seeing something related to response. Now, NCLEX was telling you appropriate response. Response. That is scaring question right there. That's scaring question. Now, nursing process on the NCLEX exam, NCLEX is only going to test you about assessment, intervention, evaluation. Now, the problem is this: a lot of students don't understand how NCLEX tests nursing process. Right. Now, let me explain how the NCLEX tests nursing process. Now, if NCLEX want to test you on assessment, NCLEX will test you separately. It will be a single question. If NCLEX want to test you about intervention, it's going to be a single question. If NCLEX want to test you about evaluation, it's also going to be a single question. Unlike nursing school, whereby NCLEX can group everything all together. Right. Most students will be saying, oh, assessment has been done, so what we are going to proceed is doing intervention, this and that. All that don't work on the NCLEX exam. Now, let me explain. If NCLEX is testing on assessment, the body of the question will say something related to that. Maybe the question can talk about what? Collecting data or patient newly admitted. Now, right, you should know situation whereby we assess. Now, if you are collecting data, you are assessing, right? If patient is newly admitted, you are going to start with what? Assessment. If patient don't have a diagnosis, and NCLEX is just giving you the patient sign and symptom, it means that you are going to assess. Right, that's what you need to know. The question can either say collecting data, right? Or the question will say admitted, something related to admitted, or the question will say sign and symptom. Right, just sign and symptom without diagnosis. Now, the initial thing we are thinking in this case is what? Assessment. Assessment. Right, that is the initial thing we are thinking about, to assess the patient. Right, so now if we are thinking about what? Assessment, we need to look for a specific answer related to assessment. Now, there are different ways NCLEX can test assessment. Now, NCLEX can tell you a patient, right, got a wrong medication. What are you going to do first when you are seeing the patient? You need to what? Assess. Right. You need to understand situation that prompt you to what? Assess. And situation that prompt you to give what? Intervention. Now, if the NCLEX is testing you as well too on intervention on the NCLEX exam, NCLEX is going to write it. You are going to see the question. It's going to talk about plan of care, right? Or NCLEX will say planning care, and then this will be in the body, and then the stem of your question, you are going to see what? Intervention right there. So you know this question is testing your what? Intervention. Right. There's another way NCLEX can test you on intervention as well too. NCLEX can say immediate, right? Intervention. Immediate intervention. You are going to see it when you read the stem of the question. Immediate intervention. Right. So you know NCLEX wants you to what? Intervene. Right. So you are going to see it. Now, there you can see question on the NCLEX exam, right? That will test your ability to skip assessment, right? And jump straight to what? Intervention. You are going to see question like that. Now, the only reason why we are skipping assessment and jumping straight into intervention is is because what the patient is experiencing, right, is life-threatening. So we need to fix that using what? Intervention, then later come back to what? Assessment. Right. There's a lot I can say about that. Wow. Let me talk about the next one. Now, your clinical judgment type of question, right, is your what? Case study. Your clinical judgment type of question is your case study. That's your okay. That's your recognizing clue, right? You recognize clue, you do the analysis of the clue, right? Recognize the clue, do the analysis, you prioritize hypothesis, right? You generate solution, you take action, and you evaluate. Now, trust me, a lot of students don't even know this. A lot of students answer case study without not even knowing the C's part of the case study. How are you going to be answering case study on the NCLEX exam without not even knowing the C's part of the NCLEX of the case study? That looked like a joke to me. Now, one, recognize clue, analyze the clue, that's two, prioritize hypothesis, that's three, generating solution, that's four, taking action, that's five, six is to evaluate. Now, the reason why you need to know it, you might ask me, oh, why do I need to know it? I did not see any reason to know it because a lot of students don't see any reason to do anything. The only thing they know is that they want to pass the NCLEX exam. Now, you cannot only say you want to pass the NCLEX exam, you need to know the roadmap to passing the NCLEX exam. Question bank is not your roadmap because question bank can create what? Confusion. If you don't have a solid plan or you don't understand the NCLEX. So your first thing is to understand the NCLEX, create a plan to avoid confusion, do well on your question bank, and then pass the exam. That is how the NCLEX work. So now, for your case study, you need to understand recognizing clue because recognizing clue involve what? Assessment. That way, you are only picking out what is wrong. You are selecting answer related to what is wrong with the patient. Now, maybe the patient is having shortness of breath, pain, right? Low blood pressure. This what is wrong. Now, the second part of your question, which is analysis, you are not trying to find out why is this patient having shortness of breath? Why are they having pain? Why are they having low blood pressure? You are doing that analysis. Based on the information, you are trying to find out why, what is causing it. Right. We don't diagnose when you are doing case study. You don't diagnose. When you get to generating solution, the NCLEX is going to give you the diagnosis of the patient. So it's not your duty to diagnose. That's the doctor duty. NCLEX will give it to you when you get to generating solution. So if you are doing your question well, when you get to the number the fourth item, which is generating solution, you will see that the diagnosis is in line with what you are doing. Now you want to select the problem, which is what I've listed here. You want to analyze those problems. Then, based on this problem, the prioritizing hypothesis is that what would the patient be at risk for? Patient is having shortness of breath, they're having pain, they're having low blood pressure. So what would patient be at risk for? Now, if they're having shortness of breath, they can be at risk for what? Hypoxia. If they're having low blood pressure, they can be at risk for what? Hypovolemic shock. You can see. So now, but NCLEX might give you hypoxia, hypovolemic shock. Then you now have to now decide which is more priority, right? And select the answer based on what? Prioritizing hypothesis. Now, we now know what the patient can be at risk for. So in order to avoid that problem, we are now going to create the solution to solve those problems, which are all these things. What are we using to solve shortness of breath? Maybe it's to assess their respiratory rate, check the oxygen saturation, or what? Maybe give them bronchodilator, oxygen, right? The pain, we are giving them pain med. The low blood pressure, we are giving them medication to increase their blood pressure or IV fluid, right? That is your generating solution, right? Or okay, your generating. I've skipped to the taking action part. Now, your generating solution, NCLEX can say, okay, this is generating solution. Let me explain again. Now, generating solution is that NCLEX is going to give you a list and tell you what are you going to anticipate, right? Anticipate, right? They'll say, which of the following doctor order should you anticipate? Something like that. Now, take action is when you not take action based on what the NCLEX has provided to you to solve all these specific problem. And evaluation is now to now see, based on everything we have been doing for the client, what NCLEX can say if the patient can ask you if the patient have improved or not. So they might ask you to select answers related to what patient has improved, or maybe the NCLEX can ask you to select answer that show that the patient has not improved. So you can see NCLEX is not difficult. Now, culture and spirituality. Now, culture and spirituality part, right? The culture and spirituality part is this. Now, it's very simple. I love to see culture and spirituality type answer on the NCLEX exam, because the instruction NCLEX is giving you is that when you see any answer related to culture and spirituality, respect it. Don't judge. Add it to their plan of care. So when I'm seeing a particular question and one of the answer key is saying something related to culture and spirituality, I'm selecting the answer straightforward. I'm not thinking about it because it's correct. Right, because that is the rule. Now, teaching, you have seen that kind of question on the NCLEX exam that is saying, a nurse is teaching a client about so, 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 and so, or the nurse taught the patient about so, 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 and so. Now, when the NCLEX is testing you about teaching, is it that NCLEX is saying, what are you going to include into the teaching plan, or the NCLEX is testing you correct or wrong understanding about what the patient have what made mention to you, right? The patient statement to you. Now, learning, on the other hand, is for staff education. You've seen that question that test on what? Staff education, right? I'm speaking to most students that have taken the NCLEX exam before, right? You see that particular question that say, uh, you attended a staff education program about, or you are preparing a staff education program about, you know. So NCLEX will either test you for correct understanding about the staff program teaching, or maybe ask you to include something to what the staff program what teaching. Or NCLEX might say, you attended a staff program about which of the following statement made by one of the staff is incorrect. Right. So that is how NCLEX test teaching and learning question. Now, communication and documentation, I also love to see questions like this, because if your answer is related to communication, trust me, select the answer, it is correct. Right. Or if your answer is related to documentation, select the answer, it is correct. Because NCLEX want to test to see that you know you can document. So there's two ways. Is either NCLEX want to test to see if you would omit documentation, or NCLEX want to test to see how you can document a specific care. They might say you recently inserted IV access, right? Or PVAD, which is peripheral venous access device, right? You recently inserted that, and then NCLEX want to now see from the selected answer which one is the correct documentation. That's how NCLEX test it. Now, communication involve staffs or team member, client, unit, department, right? So all this involve communication. You can communicate with staff, other team member, client, unit, department, family member, right? That's communication, right? So it's very important that you are able to communicate with all these specific what people right here, right? Always communicate with the family member. Any answer that is telling you to communicate with the family member, communicate. Except if what you are communicating is related to what? Confidentiality. If not, communicate. Involve the family member in their care. Right. So that is how communication works. There's a lot to say about it, but the moment you can understand this six concept, you are going to find out that on the NCLEX exam, let me clean up. This is very powerful, right? Now, you'll find that on the NCLEX exam, your answer keys are written in line with these six concepts. But the thing is that we don't see those six concepts. Instead, we see the content. We want to see that hypertension we learned in nursing school. We want to see that diabetes we learn in nursing school. We want to see that MI we learn in nursing school. We are forgetting that we are not being tested based on what? Nursing school knowledge, like nursing school question style. Let me just say nursing school question style. You are not being tested based on what? Nursing school question style. Instead, right now, NCLEX is trying to use what you've learned in nursing school, right? In order to see if what you can practice with it and show that what you are a safe nurse. That's what NCLEX is all about. So leave that too much information you have, right? You've used that in order to graduate from nursing school. Congratulations. Now, welcome to the NCLEX world, whereby you need to be familiar with what? The NCLEX test plan, which we have right here. I remember the RN, we have 146 content. The PN, we have what? 150 content. Now, when you know this content, right, the next thing we are waiting for is how what the NCLEX will test us in regards to what this content. Now, let me recap the parts, the 3 parts we have. Let me clean up a bit. Now, let me recap the 3 parts we have. Now, remember we have your question like this. 1, 2, 3, 4. We have the body, we have the stem, and then we have our answer keys. Your body contains the content, the stem is the examiner question, and then your answer key to select your answer. Right. There's an advanced thing we use the answer keys for, but for now, this is what I'm going to leave you with. Now, the stem contains what? The examiner question. Like when you're in nursing school, your lecturer give you what? The content that will be tested, but we don't know the question. But guess what? When we try to know the question, this is what we do in nursing school. Now, you know, you know, your lecturer is going to test you on hypertension, right? So now, what do we always used to do? We ask people that have taken exam under the same lecturer for what? Past question. We'll be like, oh, our lecturer want to test us on hypertension. Can you give me idea of what you ask maybe a previous set. Did you take any test related to hypertension under this lecturer? And they say yes. He always used to test us on that. I say, okay, do you by any chance have what questions, past question? And they say yes, they have past question. Now we look at the past questions to see how that lecturer tested them on what? Hypertension. We do that a lot. Now, that is the same concept related to the NCLEX. Now, do you know what I did? NCLEX have 1,940 or 70. I can't remember so well again. Now, past question. Now, I already know the NCLEX test plan contain the content. I've gone through the 146 content because I took what? The NCLEX-RN. So I've gone through the what? The 146 content. Right? Now, I've gone through the 146 content. Now, and I want to now know how the NCLEX tests the question. So I did my analysis, right? I did my analysis utilizing what? 1,940 NCLEX past question. All I was just looking at is the stem. I was trying as much as possible to identify the content that I saw right on the body of the question. And as well too, I was looking at how the NCLEX write the question. And I noticed that despite the fact I went through 1,940 questions, I noticed that NCLEX just utilized what? 62 ways of writing the question. So one way can repeat 13 times. Another way might repeat 14 times, like that same writing style. So what is this telling you? This is telling you if you can have access to the 62 ways NCLEX write the question, you know the content that will be tested on the exam. This way, you are not going to go on the NCLEX exam with confusion no more. Now, all you just need to just do, right, is to identify what content the NCLEX is testing. Previously, before previously you were studying, now you want to take the NCLEX exam. Now, all you just now need to do, you've studied all the whole 62 ways NCLEX test, write the question. Now you understand the kind of answer the NCLEX is expecting. Now, all you just want to now know is, okay, NCLEX is testing this. they're asking this related to this content. So this is the likely answer I should be able to see right on what? The answer keys. So now you've taken away that 75, like out of 100%, now you are not 75% ready to get the answer correctly. You can see now 75%. So now if you have 75% throughout your 85 question in selecting the correct answer, you will pass. Because you've done 75% of the job. Now you will pass. Because now you don't have to be thinking what the question is asking, what is the examiner saying, you don't understand this writing style. Instead, you will be more focused on what? The answer keys. You can see how it works. Right. So now you know the roadmap. You know the roadmap in passing the NCLEX exam. Now, except if you like to fail, that is when you are going to ignore the NCLEX test plan. Now, but if you don't want to fail the NCLEX exam, you are going to get the NCLEX test plan document, right? And then check through it, go through the content, get familiar with it, and you're ready to pass. Now, the moment you can go through the NCLEX test plan, if you are taking the RN, remember 146 content. If you are taking the PN, 150 content. The moment you can go through it, you get yourself familiar with it, right? Now, the NCLEX have past questions. Right. The current one, they have current one. We have a 130 question currently, past question for RN, and 121 for PN. Now, if you go through this question, you can start identifying the content that you can see on the body of the question. Right. Start identifying that. Start identifying that. That is what you need to do. This document work together. You don't need your question bank now. Leave your question bank for later. This is what you need now. The NCLEX test plan, the past question. That is what you need to do. Because on the NCLEX exam, that is what you will be doing. You don't want to start doing that on the NCLEX exam. Because you want to be clear. I teach my students the 3 C's. I call it what? Clarity, confidence, and then setting. I want my students to have clarity. They should, when they have clarity, they feel confident and they are certain about their answer selection. Right. So this is what I want to give to you as well too if you join my coaching program. Now, so in my coaching program, right? So now you have the body, you have the test plan, the content. Now you have the past question. So now you are going through the past question. You are trying to see if I happen to take, because now you have 130 question RN, 120 PN. Now the goal is for us to pass the NCLEX exam in 85 question, right? Now, but we have over 125. So now you have to now look at it and ask yourself, go over the test plan, the content, and go over the past question and figure out how many of the content were you able to identify. That shows how ready you might be for the NCLEX exam, because figuring out the content is not just enough to passing the NCLEX exam. You still need to understand what the examiner is asking and select the correct answer, right? But when you're able to figure out the content, maybe out of 130 questions, you were able to figure out 100, I can guarantee you are 50% ready to pass the NCLEX exam. Right. If you figure out that you are 50% ready to pass the NCLEX exam, if you figure out as well to 90 question right here, I can guarantee you, right from the PN, you are 50% ready to pass the NCLEX exam. Right. Now, if you now understand the 62 ways, right, NCLEX write the question, and you can easily be saying, if NCLEX write the question like this, this is what they're asking. This is what they're asking. That is an additional 25%. That is why I initially said you are 75% now ready to what? Select the correct answer. 75% of the time, you always select the correct answer because now you have that low chance of selecting the wrong answer. Because now you understand the content, you know what the examiner is asking. Selecting the answer should not be difficult at that point. Right. That is the reason why my students end up passing the NCLEX exam in 85 questions, because this is the approach as which I tell them to to take, right, in order to pass the NCLEX exam. Many of my students pass the NCLEX exam in what? 85 questions, utilizing this approach. Now, where do I come in? Where I come in now is that you know the NCLEX test plan, right? You have tried to figure it out from the question, and you can be able to evaluate that, yes, you are doing well doing that. Where I now come in is this. Now, I come in the aspect of breaking down question with you. That's where I come in, breaking down question with you, right? Which I'm going to do a lot, right? Now, I'm going to do a lot. I'm going to break down the 130 RN pass question and the 121 PN question. Now, this is my principle. I believe in order to pass, I've been using this for the past 2 years. In order to pass, a student needs to understand the content, know how the NCLEX writes the question, and be able to understand it. This is where the breakdown comes in, right? The content, I'm going to introduce it to you, which I have just done, right? By telling you RN 146, PN 150, right? So, but I'm just giving you overview of the amount of content, right? We are still going to go deep into the content, where I'm going to be like showing you right from the NCLEX test plan. Now, the next part is to understand how the NCLEX write the question. Then we are now going to start breaking down the understanding from what the 62 ways NCLEX write the question, right? When we end up breaking them down, right, then we can now start breaking the understanding from the full question, right? That's when I will now start teaching you my teaching method, and then, right, we utilize a lot of ways to answer the question. Now, this is my belief, right? Let me show you my belief. My belief is this. In order to pass the NCLEX exam, this is my belief. Because my program is what? 8 weeks program. So we do content, which we do for 4 weeks. Then we do questions for 2 weeks. And then we do strategy for the last 2 weeks. So now, if you have gone through the content, you do the question, I expect you to meet up 60 to 90% pass rate, right? Which a lot of students achieve 90, even 90 plus, right from just the content. Now, the next part is the strategy. Now, we'll teach you strategy. Now, with strategy, I expect your pass rate to increase by what? 75 to 95 what? percent. This way, and I feel like you are ready to take the NCLEX exam. Because now I know one thing about you, or I know one thing for sure, is that if content is not helping you to answer the question, you will likely apply strategy and you'll be able to answer what? The question, and you'll be able to pass. Right. So in the aspect of breaking down question, that's when I give you most time some shortcuts that can be able to help you to pass the NCLEX exam. Now, let me recap the most important thing you need to know for the NCLEX exam. Right. One, you need to know the NCLEX test plan content. So this is where you get the content. You need to know the 3 parts of NCLEX. Let me say 3 parts of NCLEX questions. Right. You need to get the NCLEX past question. Right. You need to get the NCLEX test plan, the 3 parts of NCLEX question, right? And you need to get the NCLEX test NCLEX past question, I mean. Right. So you need to get all these documents. Right. So if you check below description of this video, you are going to see a link to get the NCLEX test plan. Be it you are taking the NCLEX-RN or PN, you are going to see a link to get the NCLEX test plan, right? And also for the past question, you are going to see a link to get the NCLEX past question, right? You are going to see one link that give you the past question for RN. You're also going to see another link that give you the past question for PN, and you're going to see a general link for case study and bow tie question, right? So both RN and PN can download this, right? Because this is for both RN and PN. This is for PN, this is for RN. Now, what I do in my course program is I utilize both RN and PN together. Be it you are taking RN exam, you are still going to answer PN question with me. If you are taking the PN exam, you are also going to answer RN question with me. Now, the content on the NCLEX RN and PN, right? There's no difference between the two content. The only difference is that when NCLEX is writing the question, they write the question related to what? The scope of practice of each individual. So when the NCLEX is saying you are planning care, this is RN's writing style. But for PN, NCLEX is going to say you are contributing to the plan of care. So NCLEX is still testing plan of care, right? But NCLEX is saying you are planning because RN have the ability to plan. But NCLEX is saying you are contributing because PN don't have the ability to plan. Instead, they can what? Contribute. You understand? So it's just the writing style that is different. The content is the same, right? The only thing is that earlier on I said we have 146 content, 150 content, but there are more content they included, right? That we don't have what right on the what NCLEX-RN. And there are some content on the NCLEX-RN that is not on the NCLEX-PN. There's some content on the NCLEX-PN that is not on the NCLEX-RN. So different exam, but the content that PN should know, NCLEX also, the RN also need to know the particular content as well, those particular content as well too. So it gives us wide range. So now we are practicing 130 question plus 121. That is what? 251. And guess what? I want you to pass the NCLEX exam in 85 questions. Now, if we happen to finish what? Every of these 251 questions written in form of NCLEX style with no confusion, directly taken from the NCLEX test plan, tell me how you are not going to pass the NCLEX exam in 85 questions. Right. So tell me how you are not going to pass. Right. So I'm going to my next teaching session will be related to what? The NCLEX test plan. So that's what you need to know, right? So we are going to go into the document, right? The one for what? RN and the one for PN. So we are going to go right into those documents, and then I'm going to show you everything we have on the document, and as well to show you what the most important parts, because we are going to what? Be studying smart and not hard, right? So we have 5 important parts of the NCLEX test plan content, and then we now want to like build our strong knowledge on what? Bow tie and case study. Right. So bow tie, case study plus the 5 additional parts that give us 73% of the exam. Right. Imagine knowing 73% of the exam. We are going to pass because it takes you to just know 51%, because 100%, right, to be above the passing standard, you need to be 51%. So if you know 51% of the exam, you pass. Now, but I'm going to give you 73% knowledge. Then bow tie, case study, you are going to pass the exam in what? 85 questions. So see you in my next video.